Hello, everybody. Good afternoon. We'll go over some of the updated data and then address a couple issues and take some questions. No deaths over the last 24 hours. Again, good news there. We've lost 204 residents directly to COVID-19 since March 16th. Certainly, we want to continue to remember them and think of them and their families. Looking at testing, we've received 2,173 tests in Onondaga County since yesterday. Good day of testing. Hospital numbers, 13 individuals are in the hospital. 5 are ready to return to the senior facility that they live in. They've been cleared, just waiting for a negative COVID test. Again, once you're considered recovered, you may still test positive for COVID, so that it could be a period of time for these individuals still to be in the hospital. But when you look at the individuals related to COVID that are receiving consistent hospital care, there's 8 people, which is a great number. So happy about that. 2 individuals in the ICU. Out of the folks in the hospital, 11 Caucasian, 1 African American, 1 of another race. Looking at positive cases, 3,590 total positive cases since March 16th. That's up 12. Infection rate at 0.55 on the day. Infection rate under 0.7 on our 7-day average. So our infection rate continues to flirt with new lows, and certainly our 7-day average now has been under 2% for essentially 10 weeks, under 1% for essentially 5 to 6 weeks. So again, going in the right direction. And why is this kind of newsworthy? Because the threats to our infection rate and our progress were travel related. Remember, we were worried about folks from hot states coming in. Those are all baked into our numbers. 3 cases today related to travel: Texas, Maryland, and international travel. The other one we talked about was colleges coming back to campus, right? So we've had college students here for over 2 weeks. Those cases that we found related to college students, those are in our numbers. And our numbers have remained very low. On some days, really, again, like we said, flirting with new low numbers that we've had throughout the process. Breakout of the 12, again, 3 travel-related, 1 from a senior facility, 8 community transmission, of which we have known sources of 4, the other 4 unknown. 167 active cases. We expect this number to hopefully drop this week as people remember 10 days minimum for a recovery process. So it's not quite 1 week of cases on, everybody gets better, 1 week off. It's really a week and a half to 2 weeks. But certainly we think we're approaching a time period where we should start seeing quite a few recoveries, and hopefully our new cases are low, so our active cases get closer to that 100 mark again. Looking at recoveries, 3,224 people have recovered. Background on cases, 2,072 female, 1,518 male. 297 under 19, 712 in their 20s, 479 in their 30s, 435 in their 40s, 533 in their 50s, 405 in their 60s, 303 in their 70s, 266 in their 80s, and 160 in their 90s. Back to school testing, some information here. Again, I know lots of reporting on the media. This will be voluntary with school district employees, but certainly the best way to know that you're not sick, asymptomatic, or folks that you work with aren't, is to get a test. So through a partnership with Upstate and Essentia Health, let's go over our first 3 testing sites. We're going to give you more sites next week with other schools, so if you don't hear me talking about this, your district yet, it's coming. Again, staff's coming back a week or more before students, so we're going to focus in on staff. We want the tests to be within a week of when they come back, so certainly that there is a level of accuracy. But these are the sites. Wednesday, August 26th, 9 to 5, Lafayette High School. This site will be for Lafayette and Onondaga Central Schools. On Thursday, August 27th, 9 to 5, Tully High School. This site will include staff from Tully and Fabius Pompey. On Friday, August 28th, 9 to 5 at Jamesville DeWitt Middle School. This will be for the Jamesville DeWitt School District as well as the Christian Brothers Academy, CBA. We will be announcing more testing sites and what schools to go through. We're also going to obviously communicating with the districts and with the various bargaining units. We would love 100% participation as we get back into school, as we know this is a great mitigation tool to further starve the virus in our community. We're also going to be developing an app with Upstate and Essentia for pre-registration. We'll give that out as soon as that's complete. Also, indoor classes at gyms. We sent out a release. They will be allowed to open up. Same rules that the state's put forward related to distancing, mask wearing. But again, we're very happy for gyms, and the indoor classes bring the same type of value to the public health of the community that the rest of the amenities at the gyms do. So they will be opened up on Monday. Again, if you're a business owner of a gym, please go online, New York Forward, register, fill your registration out. That's what's triggering us to reach out and get an inspection. And our teams have been working and are starting to schedule those inspections. Certainly, feedback on what was 100 or so of our freshman students at Syracuse University. We are very disappointed in the choices these kids have made. They're freshmen. They are the minority of the freshmen that came in. There are many, many freshmen that made the right choice. I believe now today there is almost 12,000 students that have returned to campus, and you have about 100 or so who are not physically distancing or wearing masks. And actually there was one student who was really mature. We think he needs to go home. I believe he said, "Everybody run, they can't get all of us." That student, that's just a mindset that we can't have in a pandemic. And so we appreciate the fact that you have new freedom. I was a freshman once too. You have been burdened, like the rest of us, with becoming a freshman during the 100-year pandemic. You have the opportunity, like the rest of us, to take on this virus and make history with all of us, and to build on the success we've had in our community, and to build on the success that your university has gone through with getting you back to campus so you can have these experiences. And for many of you, you're coming into a community that is much safer as far as the infection rate goes with this virus than the community you left that you call home. So here's my advice. Let's be smart. We will work with the administration if this becomes an ongoing problem. And the chancellor and the vice chancellor have been tremendous partners. And all of our goal is to have a safe return at Syracuse University so that there can be learning on campus and not online. But for these students, this is like how tone deaf some of you are. You saw what happened in North Carolina. You saw what happened in Notre Dame. And then you do that anyways? Come on. So this is going to be enforced. The university has investigations they're going forward with right now. Certainly some of these students and their comments and their mindset, maybe they're not ready yet for college. Maybe they need to go home for a semester. But again, I want to point out to the public at large who is upset. You're calling my office, you're sending me emails. I know you're upset. I know we've worked hard. I do want to bring some balance to and put this in perspective. 12,000 students, 100 of them doing and making a poor decision. We've had neighbors and neighborhoods that have unfortunately made the same poor choice. The good news is we do know that these students have not just been tested once for COVID, but twice. and that the high probability is they did not have the virus and there won't be spread. But that type of behavior is against the law, and it's not going to happen moving forward. It's against the SAFE pledge that they have all pledged to do, and it's against everything we believe in here in Onondaga County. So saying that, I'll take questions.
Ryan, we've worked so hard to get to this point. The community, the county, businesses, gyms have just opened up. School is not even started yet, and there is more than 100 kids on campus. Public safety building just a couple steps away. Does SU need to be doing more in stepping up with their enforcement? Like, how did this get out of control so fast?
Yeah, so a couple things on that. I haven't been briefed on how many personnel SU had in their public safety department or not. Certainly, I think everybody will learn through this. What I feel really good about with this incident, the concept that 100 kids is going to get together at college is not a concept that should be foreign to us. We anticipated these types of things. I'm happy that it happened now if it was going to, because they just were tested twice. But this isn't going to fly. And some of the mindset behind some of the comments on social media that we heard, it's not going to work. You're not, to our freshmen, I get it. You're away from home. You're meeting new people. You want to go meet some people, your peers. Go do it in smaller groups. And wear a mask, okay? Common sense. Wear a mask. That's the law. But what is not going to happen, and what I don't think Syracuse University is going to allow to happen, and we won't allow it to happen, is this to be the norm. And we shouldn't let this we shouldn't let these freshmen ruin this for the juniors and seniors who are probably a little bit more mature, thinking about where they're going to go for their next job when they're done with college. And I can tell you, for students in that boat, an employer, if they look back, and they look at everything, right? Everybody, they look at all the social media, they look at everything. If they see you joking around during a pandemic and not being responsible during a pandemic as a senior, and then you got to go graduate and go into the workforce, why are they going to entrust you with any sort of responsibility in their operation? So what's different between this incident and everything else is that Syracuse University worked with us, and we prepared and planned so well related to the virus. And we know that these kids most likely did not have the virus because of the testing that was just done. That doesn't mean if you start behaving like that, it doesn't get into the circle, into the unit. And they were breaking rules related to physical distancing, and they were breaking rules related to mask wearing. So we take it seriously. We're not going backwards in this community. We're going forward, and we're not going to let some boneheaded decisions bring this community backwards. So if this becomes a problem, we'll have very real conversations with SU. And SU, again, they have been fantastic partners, spending lots of money, time, resources to put all these students in a position to succeed.
Real quick, the Wednesday the 26th location, that's at Lafayette, which building?
Wednesday the 26th.
The first one?
9 to 5, Lafayette High School.
High school.
Yes.
Okay. Were you formally briefed? Did someone from SU talk to you today as the leader, really, of the pandemic response? What kind of notification has SU given you today?
Yeah, we got our teams were briefed from their folks. I thought Vice Chancellor Haney's message to the student body was tremendous, and they have an opportunity to be part of something special in this community, and they need to let that happen. And I don't think if some of these kids are going to be a problem, we can't let these kids ruin it for the rest of the kids that aren't a problem. So I think the university is going to take that very seriously.
He didn't hold back in his message. He said, quote, may have done enough damage to shut down campus. Do you agree it was that serious?
I think if this were 2, 3, 4, 5 weeks later, where you had a situation where you had that type of gathering and we just didn't have fresh COVID testing data, that's what's saving these kids in my temperament right now, is that these kids were just tested. And we just got results back. And I know what the infection rate on SU's campus is lower than ours in the county. It's 0.02. There's been over 10,000 tests done You'd see a different type of discussion right now if that wasn't the case. So I think now it was bound to happen. The question is, from these gatherings, what happens after? And we had gatherings in the city and in the county similar to this, where I can promise you all those people weren't just tested. So the risk in those situations was greater than this, but it was just this was caught on social media. The commentary from some of the kids just represented a kid who's more ready for a senior year in high school than freshman year in college, in my opinion. And so that kind of ticked people off. And when you've been in the trenches the way that we have in this community, and we've been fighting so hard to get these other businesses open, to make sure that they can open, and then you have that mindset. That mindset's got to go away. And the best way for that to go away is for some of these freshmen to really step up and be leaders amongst their peers and set the example.
Is every student tested or just hotspot students?
No, students were tested. Every student coming back to campus.
Including from
Correct.
local area students?
Correct.
So you're confident that every kid in that group,
And they were tested when they came back to campus.
right? So every child in that group,
Well,
student-
Andrew, I don't know if there's a child from the neighborhood that's not an SU student. I can't speak to that.
No, I know, but in general, you're
There is out of the Syracuse University protocol was that every student got a kit to their home. They had to test negative to be allowed to go to campus. Once they get to campus, they then need to test negative again. You're tested again. Some of the kids tested positive. Those kids have been in our numbers. Those kids are in quarantine. We know where they are. They weren't there. But these other kids, these were freshmen. That's who they were. And there was about 100 of them. So the idea that 100 college kids would get together is probably not, even newsworthy if it's not in the middle of a pandemic, right? But they need to know better. They're part of something bigger.
in your briefing, did any kind of punishment for these students come up?
I think they're going to, in their investigation, bring them before their process. They have, I believe, a process for students that break the rules, and then I'm sure the ramifications are very serious. And if we get to a point where we disagree, where there's an incident and we disagree and we think something should be done in addition to what the college's recommendation are, I'm happy to have that conversation with the chancellor and vice chancellor. They've been tremendous partners, and that's the type of relationship we have. We speak our minds to each other.
I know that you're saying that these kids just did get tested, but like we've seen from graduation parties, everything, it only takes one. And if this kid went out and did something else, I mean, and got the virus, went to this party, how are you going to move forward with SU if this does keep happening? I mean, like you said, those kids have this mindset of, you know, I don't care, let's run, nobody's going to catch us. If that's going to be the mindset of these kids moving forward, what are we supposed to do?
Yeah, if you got to the point where this was an ongoing situation and it's happening on campus, on the quad, you know that where the kids are, then you got to reassess it, who's allowed on campus. But we're not going to get into hypotheticals right now, because I could give you factuals about situations that we deem much more risky than what happened yesterday. They happened. We got through it. We went through it and enforced it. I understand this is newsworthy. I understand people are going to want to get into this, and there's high emotions around it because there's anxiety around the kids coming back. But I can promise you this, and I'm not downplaying this at all, but this is a guarantee. The neighborhood barbecue with 40 people there, I can guarantee you the 40 people at the neighborhood barbecue haven't gotten negative COVID tests. Guaranteed, right? So we're talking about a situation that we have done so much risk mitigation right now that it's as contained as it can be. Moving forward, we can't allow these large gatherings. And so the university is going to have to step up their game. If these gatherings are happening in the community, essentially our law enforcement and some of the teams we have will deal with it. But overall, it's knucklehead central to do this on your first or second night on campus, right in the middle of everybody, for everybody to see, and then for the comments are just incredible.
How severely do you think they should be disciplined? Would you like to see any of these students expelled or suspended?
Well, the one student, everybody run, they can't get all of us. That's Animal House type quotes there, and pretty confident in themselves quotes on their first or second day on the college campus. You don't want to pick on some kids too much, but that kid could have been having a bad day. I've had some bad days up here and been pretty grouchy at times, but that is the mindset that is not okay in a pandemic, or really any time, when they're doing these things. So again, we went through, I think the saving grace for these kids is they just all got tested twice. If this happened later on, and we're going through a situation where, to your point, somebody was positive, then we have to go contact trace through 100, 150, 200 people, and they're not cooperating, then it's a problem, and then it's impacting our infrastructure to fight the virus, and that's when we get more aggressive with what we think should happen.
Is there any fines for those students? Because I know state laws and county laws about gatherings.
I don't know who these students are. I know as much as you know. I think they will look at their cameras and try to identify who's who. And certainly we would have to look at what the rules are related to that and when you can do it, and if the district attorneys or the SPD in this case are willing to go forward and do that.
Did you speak to SU at all about doing more proactive surveillance of campus and gatherings? And I mean, this is the quad. This is the heart of campus. For this not to be seen by some sort of law enforcement on campus seems outrageous. Have you talked to them about their plan?
I was on campus yesterday, and I drove on campus today, and to see how the mask wearing was done after I heard about this, and for the most part, everybody had a mask on. That was good. I'll talk to the chancellor and the vice chancellor about what their assessment is on their own security detail. I'm not going to comment further on that because I don't have enough information.
Keeping on the SU topic, the first opponent for the football team has paused classes in North Carolina. Do you have any jurisdiction over deciding the football team should not be traveling to a campus like that?
So no, they're really. I don't know the answer if I have jurisdiction. I have emergency powers. I know that in our briefing, Syracuse University and the ACC athletic directors are taking all the proper protocols that we take here with their athletes, and essentially home and away games. Certainly, you'll have pretty much a bubble type setting for the athletes and for the staff that goes into these communities, and I think you can do that safely.
So you'd be okay with a football team visiting a campus that's deemed dangerous enough for classes to be shut down?
Well, Andrew, I think it's a loaded question, but let's break it out. When you look at a campus, you talk about Chapel Hill? They shut down in-person learning. The campus isn't shut down. So they shut down in-person learning because they didn't do any testing going back to school. And when you look at who goes to Chapel Hill, they're coming from the Sun Belt states for the most part, which drives the infection rate. There's our problem. So are our athletes safe going into the state of North Carolina if they're going from a charter flight to the hotel, to the stadium, or in some cases just the stadium to play a football game, then back to the charter flight? I think you can do that safely.
The governor talked yesterday about testing capacity in the upcoming flu season, and I'm just wondering how equipped is Onondaga County to handle the testing demand for both the upcoming flu season with COVID laid on top of that?
Yeah, we've been already, Jim, working on public-private partnerships related to the upcoming flu season. Again, I appreciate the governor's, that issue, because COVID came to us on the back end of flu season. So we had to rule out the flu for 2-3 weeks. And then the community, and I've talked about this data point a billion times, but I think it's worth repeating, the community responded with hand sanitizing, physical distancing, wearing masks, and then we had no cases of influenza A or B in April, where the previous year we had multiple cases. I don't know if it was 60, 70, or 80, but we had multiple, and then we had 0. So I think we're going to be in a stronger position going into flu season because of our habits have changed, and we're more cognizant of that. But to the point, we need to be able to make sure that the vaccine is accessible and ready in ways that it's never been before. So we're having conversations with many of our private partners about this, and we'll be ready. We'll be ready for it.
I had a conversation with Ann Rooney yesterday. I think she should fill in for you at the podium because she was very well spoken in our interview yesterday.
It's good to know.
She would hate me for offering that. She mentioned a huge positive response for teachers when you've surveyed them about their interest in getting testing. Will you be able to have capacity to get to the high schoolers after?
Yes. So we'll get through the teachers, and then we'll get, again, we want to get the kids going into as close to going into the buildings as possible, especially the high school kids, your upperclassmen, more social. And we're taking the data, just like everything. We're taking the data. Where have we seen cases? Where have we seen cases recently? All right, we got to do our best. How do we get to these folks, these demographics, to make sure they're getting tested so we can isolate the virus and box it in? So we'll get there. We have built up some pretty impressive partnerships here for back-to-school testing. I don't know if anyone's doing quite what we're doing right now. So I feel pretty good about where we are and where we're going, and mainly because of that data point, Andrew, that the faculty wants to get tested. And that's the best way to make sure that 96% of our cases have been adults. We know that. Doesn't mean kids don't have it, doesn't mean kids can't get it, and that doesn't mean kids can't spread it. But we know that the adults have been impacted by it more. And so let's make sure that we get the adults tested while they go back into the buildings. And then the kids that have been more prone to get the virus, let's make sure they get tested when they go and join the adults in the building. Then we're going to do the saliva screening, which I think you're reporting on. And then from there, we do diagnostic testing in the event we find a positive. And we're also looking at potential wastewater testing as well. So when you look at all of it, we're doing everything humanly possible to have the most successful school year in the state of New York.
But just from a supplies perspective, do you think you'll have enough test kits? If you do, say, 10,000 teachers and staff,
yes,
you'll be able to get another round of that for the high schoolers?
Correct.
Okay.
Correct. Other questions?
How are gyms in terms of attesting to their state documents, you getting that list, then setting up appointments?
Yeah, so each day we get an updated list from New York for the region about who's attested and who hasn't. The gyms, the day after we talked about this on Monday, I think we got 60 new attestations for the region. When you look at them, most of them were gyms. So that's good, because we're calling you in, we're going to set up appointments based off of that. And so that's what we need to have folks keep doing. Even if they attested, look, if you attested as a gym to something else and you got through that process already and you already did it, you got to call us then. But we're not going through the internet, Googling gyms in Onondaga County and calling you. We want you to open. You got to work with us. We've never had to do this type of regulatory work before either.
How many inspections do you have scheduled on the Onondaga County side?
Not sure yet. Not sure yet. Yeah, I think they're going to start on Monday, though. And again, there's a 2-week period, so gyms can open up Monday. Within 2 weeks, they need to be inspected.
Were there examples, though, of gyms who clearly were ready for this, hit submit, the information got you,
Yeah,
and they're already on the schedule?
Sure. And there's been a lot of them, Nikki with Aspen and a lot of these, Randy down here downtown. These are folks that have been ready. They put in CDC best practices when the CDC came up with these months ago, and they started investing in their business then. So for them, I'm very, very happy that this is happening. And again, they're going to do very similar. If you look at everything we've done in our industries that are reopening, in our community, the partners we have gone out of their way to do it right. Syracuse University being one of them, out of their way, spent millions of dollars on doing what North Carolina did not do, which was testing the kids before they got into Onondaga County. And so the millions of dollars they spent, that they're not going to get that back. So they did the right thing. Aspen and Nikki, they did the right thing, putting their business in a position for success once they got the green light. So that's happening across the board through Restart in our county. Our business community has been leading in this. They've been leading across their peers in the state, but more importantly, they've been doing it in a safe way once they get open. That's why we've seen every step of the way when we've reopened the economy, the infection rate continues to go down to the point where how much lower can it get? I don't know if it's going to get much lower. So that's something that this community should be really proud about. Other questions? Okay. I'll see everybody on Monday. Thank you.